The battle for 2020. Frustrated socialist Democrats ramping up the fear-mongering. Critics say they're trying to browbeat anyone who doesn't agree with them into their bad policies. Critics are saying that hysteria is replacing facts. Bernie Sanders is being accused of trying to whip fastballs by voters, trying to claim people will, quote, literally die under President Trump's health moves. Sanders claiming Trump would demolish Obamacare. Sanders ignoring the fact the president has yet to offer his own full replacement package yet. Let's listen.
If Trump gets his way, the cost of health insurance for you will be so high that many people literally will not be able to afford it. Thousands of people will literally die. That's Trump's health insurance plan. My plan's just a little bit different.
That's Bernie Sanders there. His plan would get rid of Obamacare. It would get rid of also Medicare, Medicaid, and all private insurance. Joining me now is GDP Advisors President and healthcare expert Seth Denson. Seth, this sounds like granny off the cliff time again.
It does. I mean, listen, this is an old playbook that the Democrats will point to, right? I mean, I've heard this type of statement before, and I think that that's what Bernie Sanders is playing into. As you alluded to, Liz, President Trump hasn't rolled out specifics to his plan. He is doing some things about bringing transparency into the system, which is actually going to drive down the cost of health care, unlike the ACA, which really was just impacting the finance system.
You know, Seth, President Trump has relayed and tweeted about what Democrat studies and Democrat analysts have admitted, that the cost of Obamacare has been going up. Here's the president tweeting, it's far too high for our citizens. The deductibles in many cases way over $7,000, makes it almost worthless or useless. Seth, what is the Republicans' plan?
Well, listen, what the Trump administration has already started doing is laying out groundwork under Alex Azar and infusing transparency into the system, targeting prescription drugs. These are the things that are really driving the cost of health care. The Affordable Care Act focused on insurance, and most Americans think about health care and insurance in the same manner, but one is just the credit card. So we need to drive down the cost of the goods of services, and if we do that, the insurance in turn, that will come down too.
You know, whenever the new government plan is rolled out, fraud immediately steps in. That's what happened with Medicare, Medicaid. Look at this, Social Security, tens of millions of benefit checks mailed to dead people. That's what's happening.
Yeah,
Seth.
I think that this is just more proof of why we don't want the federal government running a system, and specifically in healthcare. I mean, if we can't even keep track of money to people that aren't living anymore, what are we going to do about when we're trying to deliver healthcare as a federal government as well?
Yeah, we looked at Medicaid abusers. They are people living with Bentleys, Rolls Royces, Ferraris. We saw mansions, we saw vacation homes, people ripping off the Medicaid system to the tune of $141 billion. That's what Chuck Grassley and his colleagues are saying. What do you think, Seth?
You know, it's really sad. I think that we need a better checks and balance system in these federal programs to make sure that the funds of the taxpayers are being used efficiently and effectively.
Seth Denson, great to see you. Come back soon.
Thanks, Liz.
Coming up, a second woman